This is a personal anecdote from Dr. Daniela J. Lamas, a story about a woman, the wife of one of Lamas's patients, who had expressed distrust in her husband's medical team when she was faced with a difficult and critical decision. The woman's husband, Lamas's patient, had cancer. He'd been admitted, but it seemed that his condition had worsened overnight. He was in pain and struggling to breathe. His wife had requested he be given a breathing tube. However, as Dr. Lamas explained to her, he'd be sedated, and upon removing it when the rest of their family arrived, he'd be given a conscious awareness of drowning. One could only imagine how this woman felt in that moment. There her husband was, the man that she chose to stick by in sickness and in health, dying, and the decision to prolong his life at the risk of causing more suffering placed in her hands. She'd put her trust in these doctors, in the healthcare system, but they could not save him, and even worse, her only choice was to let nature take its course, otherwise inflict more pain onto him, which is what made her response both shocking and understandable. Why should I believe you? I don't think that I do. Dr. Lamaze was at a loss for words. She asked herself why the woman should believe her. She wondered if the woman's distrust was a result of her attire, gender, or age. Regardless, she knew the true cause was deeper than those things. This woman was struggling to trust llamas because of the healthcare system, because of an industry that has constantly failed the public both in large and small ways. Dr. Lamas realized that this woman had every right not to trust her, or any of her husband's medical team. In the end, Lamas sat with the woman, giving her as much time with her husband as she could. The woman's husband remained alive without intubation. The rest of their family arrived, and after he passed, they were allowed to take his belongings home. As his family left, Lamas could only hope that they knew she and her team had done the very best they could for their loved one. Alright, and these are the citations for the story that I used. And switch over to my camera. Alright, hello, my name is Zion Ruffin, and I'm a student at Sam Houston State University. Over the past 2 decades, America's trust in the medical system has been a constant low, and in recent years has begun to further decline. This lack of trust has led to fewer individuals seeking help and heeding the counsel of doctors when faced with concerning symptoms. Upon further research, I found that a huge reason for this is because of a lack of trust in doctors specifically. To remedy this, doctors should utilize the patient-centered care model, which focuses on more than just the patient's physical symptoms and has shown that it can also improve the patient's physical and social well-being as well as their satisfaction with the care they receive. By implementing this model, doctors may be able to regain the trust of the American public, which in turn will encourage more people to seek and trust the advice of doctors. So let me switch over to the presentation again. All right. So as I mentioned before, today I'm going to be discussing medical mistrust and what can potentially be done to fix it. So while they're not entirely to blame, again, for the American population's lack of trust in the healthcare system, a major reason as to why people choose not to seek medical attention when they develop concerning symptoms is because of a lack of trust in physicians. According to a qualitative study done by Tabor, Leva, and Krasowski, as can be seen here, if it'll load. But according to this qualitative study, one of the main causes for medical mistrust is unfavorable evaluations, and physician factors were the top reasons for these unfavorable evaluations. Upon looking at the highest ranked physician factors that led to unpleasant evaluations, which were low confidence in the doctor's expertise, communication issues, a lack of trust in the doctors in general, disliking doctors, and believing unnecessary tests or medication would be given. For the most part, trust seems to be the issue. A lack of trust in the doctor's skills, a lack of trust in the doctor in general, and a lack of trust in the doctor's intentions. And again, this isn't mainly the fault of doctors, as can be seen from how much organizational factors and effective concerns such as waiting room times and
the fear of receiving bad news also play a part in creating this lack of trust. As a result of these factors, however, trust in the medical system has begun to dwindle. Let me So, according to both the Gallup News and GSS Data Explorer, which is in the blue and Gallup is in the yellow, trust in the medical system has rarely been high, but based on Gallup's data, trust was high in 2020 during the pandemic and has since begun to rapidly decline again, as can be seen from both data sets. Oops, nope, don't want to add another one. All right, so what can be done about this? One thing doctors could do to regain the trust of their patients is by using a patient-centered care model. This model focuses not only on the patient's physical symptoms, but their finances, emotional well-being, social well-being, and values, while also working with the patient to pick the best treatment plan. It's a model based on on principles such as transparency, empathy, consideration of the patient's environmental and physical needs, continuity of care, and respect for the patient's preferences. According to Francis Frayed in Anne Morris's article, Begin with Trust, the three core drivers of trust are authenticity, logic, or a person's faith in another person's judgment and decision making, and empathy, all of which are represented in the patient-centered care model. So, in a 2019 study done in the Netherlands, 216 multi-morbidity patients between the ages of 47 and 94 from 8 different primary care practices were given surveys regarding the care they received. What the researchers found was that the implementation of the patient-centered and co-created care model significantly impacted the patient's satisfaction with the care and their physical well-being as well as their social well-being. So here are the citations for these articles and the data. We'll switch back to my camera. America's healthcare system has a long way to go. Many issues, not just those caused by physicians, need fixing, such as mentioned before, waiting room times and the cost of treatment. For now, however, we must take small steps towards a better healthcare system, and we can do so by improving the trust the public has in doctors. With the patient-centered care model, which has proven it can significantly improve a patient's physical and social well-being as well as their satisfaction with care, I believe that physicians may be able to regain the trust of the American public. Thank you.